and welcome to my channel. My name is Jazzy RN, and I've worked remotely as a remote nurse for the past 9 years. I work in utilization review, which is also known as utilization management. So I'm going to show you how to edit your resume to get the job interview for the jobs you want. So we're going to start off with Humana. I actually find most of the jobs that I want to preview on this channel through LinkedIn. This is a utilization management nurse. This was posted 2 days ago. So far, 11 persons have clicked to apply, and this job is based in Utah. Now, even though it says Utah, it could be other states that this company could be hiring for as well. So we're going to scroll down and focus on the job description. Now, the required qualifications is the patient, the employee must be an RN in whatever state with no disciplinary action. The nurse must also have 3 years or more of clinical experience, must also have experience using Microsoft Word, Outlook, and Excel, and prior experience in working independently and with a team. And then preferred qualifications are a bachelor's degree in nursing. They want you to have health plan experience. They want you to have experience in utilization management. And they want previous Medicare experience as well as Macmillan MCG. So we're going to focus on the very top 4 skills they want you to have. And this is the RN license. So your resume, you want to make sure you have licensed registered nurse. Also, you can put BSN in there if you have your bachelor's degree, which is would include this very first bullet down here for preferred qualifications. And also include in the state of your state with no disciplinary action. The next bullet you have, this one says 3 years of prior clinical experience, etc. Make sure your resume has the same exact thing, but you put how many years you've worked as a nurse. And the same exact wording, but if you have acute care or home care or long-term acute care experience, make sure you put it in this area instead. The next bullet point says prior experience utilizing comprehensive knowledge of Microsoft Word, Outlook, and Excel. You want to put the exact same thing in your resume. Now, if you don't know much of Excel, it's not used very often, Excel is used, you're basically just entering information in there or deleting information. It's not where it's really in depth where you're making pivot tables, whatever that is. If you don't know much about Excel, just go to YouTube and look up maybe an Excel learning about how to use Excel, the basics of Excel. Or some companies, let's say whatever hospital you work for, they may give you free LinkedIn Learning courses. And you can learn about Excel basics on LinkedIn Learning, which is free. Now, if you have your own LinkedIn account, they will charge you for LinkedIn Learning courses, but all the companies I've worked for, the 3 companies I've worked as an insurance nurse, the LinkedIn Learning courses are absolutely free through the company on the company computer. And then the last bullet point here, prior experience working independently. I would just basically copy this word for word. Instead of saying prior experience, I'll just say experience working independently under general instructions with a team. Now make sure that your current job is always in present tense, and then your previous jobs are in past tense. I've actually seen people's resumes and they've put present and past tense on all jobs, including their current job. Just make sure your current job is present tense and all previous jobs are past tense. Now on to preferred qualifications. Now right here where it says health plan experience, you don't have any health plan experience because you've never worked as a utilization review nurse. So what you can do instead is this very last one right here. You can put experience caring for Medicare, Medicaid, Marketplace, and self-pay patients. Now, of course, you may not know what kind of insurance your patients have, but believe me, whatever patient's insurance they have, or whatever insurance your patients have, it'll be one of these 4. The next bullet point where it says under preferred qualifications is experience and utilization management are related activities, reviewing criteria to ensure appropriateness of care preferred. So this one, you don't have any experience in utilization management. Instead, what you can do is right here where it says experience in electronic health record documentation to ensure appropriateness of care and insurance assessment of utilization management are related activities. So basically, I'm going to give you an example of what that is. We also have the Medicare part included whenever we put this last bullet point, experience caring for Medicare, Medicaid, and Marketplace and self-pay patients. And Macmillan MCG experience referred, I'm going to show you more information about that as well. So for utilization management, this is basically what it is. I'm going to show you an example and create it here. Make a brand new note. Now I have a Chromebook. So instead of using sticky notes, I'm not sure if you've ever heard of that before, but I'm using Google Notes. So let's say for utilization management or utilization review, a member/patient diagnosis is bowel obstruction. I'm going to give you a rundown of what utilization management is. Now, in order for the patient to be approved, the nurse, which will be you, the utilization review nurse, has to review the clinicals against the criteria. Now, I don't have Macmillan MCG memorized. I do have Interqual memorized. And basically, Interqual and MCG is the same exact thing. You're using, it has a standard system where the patient must meet these certain standards for the nurse to approve the patient's admission, aka their authorization. And if not, then the nurse will send this information to the doctor, and the doctor will make an executive decision on whether to approve or deny authorization. Let's just say we're going to use Interqual for example. So let's say the bowel obstruction is the diagnosis, and we're going to use Interqual. Then I have a little bit of MCG experience, but not a lot. So what you can do is, so basically the clinicals, aka the, what's another word for clinicals? Medical records. So whenever you are helping your patient and caring for your patient, you're entering vitals, you're entering medications given, you're entering, let's say, output, input, output, etc. So the clinicals / medical records, or whatever's on Epic, whatever you use at your hospital, Epic, Meditech, ProTouch, etc. Let's say the CT came back positive for bowel obstruction. And this is actually what Interqual's rules. And then Interqual also wants you to have the patient be NPO with an NG tube to suction. And Interqual wants the patient to have IV fluids at 100 cc's an hour. So all this must be met in order for you, the nurse, to approve the authorization. Let's say the clinicals has all this information in the patient's chart. That means the nurse, utilization review nurse, can approve the authorization. Let's say one thing is missing. Let's say the patient has this going on, the patient has this and this, but for whatever reason, the NG tube, the suction is not there. Maybe the patient declined the NG tube. So you can't put it in there. So because this one thing is missing, then you as a nurse cannot approve the authorization. That means you have to take all this information and basically write up a template to send to the doctor. The doctor will have access to your template that you created, as well as the clinicals uploaded to the platform. So that, let's just say, for example, the platform is Cerner. Let's say, all this information is uploaded, so the doctor can see this information, and the doctor makes a decision on whether to approve or deny. Even if the patient, let's say the patient also has, you are creating your template, and you also include patient is alert and oriented ×1, and in 2, and in wrist restraints. So now the patient is not only just a patient, but the prisoner, because he or she is in restraints. Even though that's so, the restraints does not allow you to override this lack of NG tube to suction and approve it. You still must send to a doctor. So that's in a nutshell of what utilization management is, aka utilization review. You have criteria uh, that Interqual has, or criteria that MCG has, and if the patient does not meet all those criteria, you have to send to the doctor. If the patient does, that means you can just approve the authorization, and basically it's rinse and repeat. Now, another thing regarding Macmillan experience and Interqual experience, in order to get that, you want to either go to, let's see, there's a website called mcg.com. And this site, you can go here, and if you want to take a certification course, you can. Now, most companies, out of the 3 companies I've worked for, all 3 used Interqual. One company first started with Interqual and then went to MCG for 2 years and then went back to Interqual. So if you want to spend the money to get an MCG certification, you can. They're not very cheap. I think they start around $200. If you were to get a certification, I think they added some. Let's see. You don't want medical director or physician advisor. You would want I would say this one, the MCG Care Guidelines Specialist Certification. And this is mcg.com. And it will take you directly to the courses. And if you want to get Interqual instead, Interqual is more widely used because the companies I've worked for used Interqual. So there's a website for Interqual, and it is ccmcertification.com. Now, I'm not actually promoting any of their websites. I've never actually paid for any of this. The company that you work for, they will train you on an MCG or Interqual, as well as their platform. And a platform is like Epic, Cerner, ProTouch, Meditech. Those are platforms. But whatever company you work for, their platform will be only for their company. You won't be able to use that platform and, let's say, go from Humana to CVS, and they're using the same exact platform. The only platform that basically repeats itself is either Interqual or MCG. This is ccmcertification.org, and this is actually owned by Optum, and Optum is owned by United Healthcare. So you just want to click on Optum Insight. This is the first thing you'll see. There's a little hyperlink here. Click on that, and there are several courses here, and they all start at $200, most of them. I would suggest you want the basic. I think it's on page 3 or page 4. That's it. So you want Acute Interqual Applied Knowledge. That one looks like it's the most basic, and it's basically showing you the key concepts of Interqual criteria and the process of conducting a review to determine medical necessity. This is what you need if you want to get any kind of Interqual training prior to getting the job. That way you can say that, hey, you have experience with Interqual, you took a course, and you took a course with a company that actually created Interqual, which is ccmcertification.org, and this is owned by Optum, and Optum is owned by United Healthcare. And this course is $200. It's actually for care management. I have no idea who actually have taken this course, but it could help you with your job application whenever you're applying for a utilization management nurse position. And the next job I want to show you is with this company called Cadence. And this is a remote licensed practical nurse, and it's for the California license required. And you want to do the same exact thing. This actually is seeking a health coach, and you must be an LPN, provide patient care remotely alongside our RNs and nurse practitioners. It's 8 to 5 Pacific Standard Time, what you'll be doing, and what you'll need. So they want you to have a multi-state compact license as a practical nurse. You want to have an active California state license is required. Now they want 5 years experience as an LPN, etc., etc. Now regarding the Wi-Fi speed test. Not many companies do this. Some companies do require Wi-Fi speed tests, some don't. They want you to have highly skilled in behavioral-based coaching, possess excellent clinical acumen and competency in patient assessment. So basically what you'll do here, I'm going to go back to my Google Note. I'm going to create a whole new one. Remote nursing. And we're going to take note. And we're going to do the exact same thing. So for here, you see where it says provide one-on-one coaching and support to patients. You do the exact same thing as a nurse in the hospital. Providing one-on-one coaching. And if you want to add, instead of just type 2 diabetes, hypertension, and cardiovascular disease, you can add, let's say, asthma. You can add COPD, asthma, COPD, etc. If you want to add more to that, you can. That covers that. Conduct comprehensive assessments of patients' health status. You do that in person as well. Lifestyle behaviors, nutritional habits, and readiness to change. You can copy and paste this whole exact thing. If you want to add your own flair to it, you can, but those keywords are very, very important. Don't replace the keywords. Just add more words to it, but don't change it. Another one, help patients execute on their personalized care plans and goals, focusing on behavior modification, nutrition, physical activity, and self-management strategies. So basically, you can just copy and paste a lot of this. This is a very easy job to apply to. Educate patients on disease management, medication adherence, symptom recognition, and prevention strategies. So basically, you do this every single day as a bedside nurse. You're presenting them with their medication adherence. You explain the medication to them, why you're giving the medication, how often you give the medication, either take it with food, without food. This is something you do every day. You're just doing the exact same thing over the phone. Now, also, I want to include that I created a course, and this course will, actually, it's not only just a course, it's a list of all the companies that hire remote nurses. And I want to give you a snippet of what this is. Now, it has links to all the companies that hire remote nurses, as well as, where is it? Here we go. As well as some details about the company. So this one is Admire. This is actually for physicians, but if you know anyone who's a doctor and wants to work remotely, many doctors do work remotely for insurance companies. Some of these companies actually also hire nurses, PRN, and night shifts. I hire LPNs, telehealth RNs, advanced registered nurses, Philippine nurses working for American companies. That's pretty common. You may have some employees that have their name dash external. They could either be a nurse from a different country, or there's maybe a contract nurse that's working temporarily. I do want to explain this one company that actually has hiring jobs all over LinkedIn, and it's called Lensa. I'm going to scroll all the way down. Okay, this company right here. You will see them have hundreds and hundreds of jobs online on LinkedIn. Never apply directly to Lensa. Look for whatever that job is and make sure that you apply directly to the company. So I'm going to go to LinkedIn now and see if we can find a job for you as an example for Lensa. It's also LifeMD. They hire remote physicians as 1099 employees and so much more. I think I have maybe over 60 or 70 companies here that hire remote nurses. Some of these companies aren't actually insurance companies. Some of them are contracting companies where they hire nurses for insurance companies. Right here. They also have the jobs posted on Lensa, and right here it says, okay, Lensa partners with direct employers to promote this job for Act Talent. So they're not actually hiring, they are promoting a job for Act Talent. And Act Talent does actually hire nurses for major insurance companies. They just hire nurses as contract nurses. So just a FYI, make sure you don't apply directly through Lensa. You look for the companies they're actually hiring for and search it on LinkedIn, or just go to acttalent.com, or just do a Google search for Act Talent and apply that way.